It is the 27th day of February 2020, the date the Federal Ministry of Health confirmed the first case of COVID-19 in Lagos, Nigeria, marking the beginning of a new normal for everybody and especially for women and girls in Nigeria. In this short feature, the United Nations Women Office in Nigeria spotlights the important leadership roles and inspirational efforts of Nigerian women in the fight against the COVID-19 pandemic.
With the lockdown, families were hit by so much hunger and so many needs. So it was, and it is still my responsibility because the effect of COVID-19 is still on. And we need to support families with palliatives. We've done that, particularly the vulnerable groups. We've also done a joint supportive program with UN Women. So the key thing is educating them, reassuring them, and then supporting them with food items and other hygiene materials to support themselves as we face the pandemic.
So as a government official, I was part of the COVID-19 palliative committee. So first, what we did was to highlight or identify the most vulnerable women, because suddenly, based on the lockdown, a lot of people moved into the class of vulnerable. So we provided palliative measures to women and the most vulnerable women within the society, and that was how we responded. We also worked with some civil society organization within the government agency, first by giving them pass so that they can rescue victims at maybe curfew hours and late hours of the night, because we received high reports of gender-based violence during the night. So we had to get pass as a local government to some of our partners who are also helping to rescue victims of gender-based violence.
During the COVID-19, I took part as a leader of a team. And my team went all out to grassroots communities, to give palliatives to people, to support them with focus on people with disabilities, of aged women and men as well. From my own NGO side, we were able to sensitize. We went to interior villages to let them know how they can actually safeguard themselves against the virus, the measures to take. We were able to speak to them in Hausa because we went to interior communities, so we communicated in the Hausa language. We'll be, working with women especially, because the women, of course, we know indirectly also are in charge of the homes, so to be able to talk to their children as well about this. So sensitization on that part personally, and for government side, I have my teams, delegations that I work with, that I was able to, to oversee distribution of palliatives in rural communities.
Information about the virus was very poor, and my first role was to sensitize people and to create that awareness. We embarked on a sensitization visits to the emirs, the emir of Gwandu, the emir of Argungu, the emir of Yauri, and the emir of Zuru. I did this in partnership with the State Primary Healthcare Development Agency, and then I took a trip to a far area of Kebbi. One of the hard-to-reach areas. You have to get to the local government by boat. It's called Ilo local government. When I got there, I realized that 60% of what we were doing had not reached these areas. I actually went there on a palliative distribution that was initiated by the Northern Governors' Wives Forum.
I think you should just wash your hands regularly. Don't touch your face, as they've said. Don't share food. Mother, please tell your children COVID-19 is still here and it can take anyone at any time. It's not friendly at all. It's really very, very harmful.
To all the beautiful women out there, I need you to stay strong. I need you to stay focused, and I need you to stay driven in the fight against COVID-19.